I want to talk about unscheduled care and how we might make it better. People contact the health service in a number of different ways if they have an unexpected problem, and those contacts can range from a visit to the GP or advice from a pharmacist all the way through to a stay in the intensive care unit. But at the moment we have a problem with flow through emergency departments, and emergency departments can sometimes become overcrowded, and that can cause safety problems, particularly in the winter. I want to think about the three different types of patient who will come along to emergency departments, and these flows tend to all come together in an emergency department and cause the crowding. The first type of patient is one who has a minor illness or injury. It's important that we make the most of our primary care services so that as much of that kind of problem is dealt with away from an emergency department. And the second type of care is people who have a serious or life-threatening illness, problems like stroke or heart attacks. We know that for patients like this, we can get better results, better survival, and better functional ability after an episode like that if care is focused in fewer places, so that we're able to provide round the care cover from a senior doctor who can make decisions immediately when a patient presents in that way. But the third type of patient who comes to an emergency department is perhaps the most important of all. And I'm thinking of older people. Nowadays, over half of the admissions on what we call the medical take will be people whose problems are predominantly because they've grown old, they're frailer than they were, and so even a chest infection or a waterworks infection that a younger person might shrug off will make them seriously unwell. Care for patients like this needs to take into account the fact that they may have more than one illness and they may have coexisting social care needs. And it's important that we do a better job than we're currently doing for them. That means we need to have older people's assessment units at the front door so that quick decisions can be made about whether hospital is the right place for a patient like that, or whether there's a better alternative, and if an older patient does need to come into hospital, that they can be dealt with really effectively. The wards need to be good places for old people to stay so that the environment is in tune with their needs, and we need to have better arrangements to get older people home, especially so that we arrange any assessment they need in their own home rather than trying to do this in hospital before they go home. That may sometimes be necessary, but assessment's often better done in the home, and that will mean better liaison arrangements with our social care partners so that people are not kept waiting unnecessarily. If we can have the right conversations about this, I'm quite sure we can provide better care for all of our patients, especially for older patients, and in turn that will make it a better job for staff working in the emergency department. They'll be able to look forward to coming into work, and they'll know that they're doing the best possible job for the patients who pass through their hands.